Good afternoon, everyone, and welcome. My name is Kevin Hagan, and I am the President and CEO here at the PAN Foundation. And we're excited to have all of you on this afternoon as we spend some time sharing some information about the impacts of the Inflation Reduction Act. We're really thrilled to have you here this afternoon. And for those of you who may be unfamiliar with PAN, at PAN, we envision a nation in which everyone can get the health care they need. But we know that that is often hindered by the high cost of pharmaceuticals. So our mission really is to help underinsured people that have life-threatening or chronic and rare diseases get the medication and the treatment that they need by assisting with those out-of-pocket costs. And we also advocate for improved access and affordability for medications. So today we are going to be sharing with you a lot of information about the Inflation Reduction Act and some of the changes that happened to the Medicare program. And as we begin, we wanted to go through just a couple of pieces of housekeeping. First of all, we do want to let you know that this is being recorded and will be shared with you via email. We do want this to be an interactive session so that we're asking you not to be shy. Use the chat function that is available on the screen to submit any questions that you have, and hopefully those can get addressed and answered during the presentation. And then we definitely want you to stay tuned, because after this webinar, we're going to share several resources with you that includes things like a printable timeline and some frequently asked questions. So without further ado, I wanted to introduce you to our presenter today, who I get the distinct honor and privilege to work with every day at the PAN Foundation. And that is Amy Niles, our Chief Advocacy and Engagement Officer here at the PAN Foundation. And Amy oversees all of our relationships and partners with the patient advocacy community, but she also leads all of our advocacy and public policy work. She's done 100+ meetings on Capitol Hill and has been featured in things like Time Magazine, the Huffington Post, all around addressing the urgent need for improved access to affordable treatment for people who are living on Medicare. Amy, I can tell you personally, is really passionate about this work. I get to see it every day, as I said, and she was really excited and thrilled that so many of the provisions that PAN has advocated for and talked about to Congress for years were included in this piece of legislation. And I know that this is a broad-ranging piece of legislation that has lots of components to it, but today we're going to address those pieces that really impact the patients that are living on Medicare. So with that, I will turn it over to you, Amy, and thank everyone again for attending.
Thank you so much, Kevin. I truly appreciate that. Good afternoon to all of you. Good morning to those of you joining from the West Coast. I thank you all for taking time out of your busy days to join us. I'm thrilled that you have, as the information we're sharing today is very important. Today, you'll learn about the key health provisions that were passed through the Inflation Reduction Act in August of 2022. No copays for vaccines, the monthly insulin cap, the federal low-income subsidy, also known as the Extra Help Program, elimination of the 5% coinsurance in the catastrophic phase of one's benefit, an annual limit or cap on out-of-pocket costs for medications, and the opportunity to pay these costs in a more affordable way throughout the year. It's not every day that Congress enacts Medicare-related legislation, so we feel these provisions are truly historic. We'll have time to answer some questions that came in through the registration process at the end of the webinar. I do encourage you, as Kevin mentioned, throughout the webinar to send questions you might have our way by using the chat feature. We look forward to putting together a question and answer document following the webinar and making this available to all of you. So let's begin and spend a few moments briefly discussing how the Medicare program has grown over the past few decades. I think this introductory information just helps to level set all of us in terms of where we've been, where we are today, and where we are headed. 57 years ago, in 1965, Medicare was established under the Social Security Act to provide insurance to people aged 65 and older, regardless of their income or medical history. In 1972, Medicare was expanded to include people under 65 with permanent disabilities receiving Social Security disability insurance payments, as well as for people with end-stage renal disease. And a little bit later on, in 2001, Medicare eligibility expanded further to cover people living with ALS or Lou Gehrig's disease. For the past 4 decades, we have seen tremendous innovation in drug development. And today we have a growing number of specialty medications that are improving and extending lives for people living with serious illnesses. Why do we call so many medications specialty medications? Well, for a number of reasons, such as the complexity of the drug itself, how it's administered, and management of its side effects. What often they have in common, though, is that these specialty medications come with high out-of-pocket costs. Drug spending in the United States today is heavily driven by these specialty medications. Did you know that in 2021 alone, we spent more than $300 billion, that's $300 billion, on specialty drugs, an increase of 43% since 2016. While 80% of prescriptions filled today are for generic drugs, these brand name drugs or specialty medications account for the majority of overall drug spending. Perhaps many of you have felt the extraordinary burden of high out-of-pocket costs for medications. You know, I'm reminded of a national study that was conducted a few years back by the Kaiser Family Foundation. They looked at the most frequently prescribed specialty medications and found that on average, people were needing to spend $8,000 per year to stay on treatment. Well, that's just too much money. One of the last major changes to the Medicare program was in 2006. Since 2006, Medicare beneficiaries have had access to an outpatient prescription drug benefit called Part D, D as in David, which is offered through private plans. These plans can be standalone prescription drug plans or Medicare Advantage prescription drug plans. Today, nearly 49 million people are covered under the Medicare Part D plans. That's a lot of people. It's a lot of people who have experienced rising costs for needed medications over many years. Let's take a pause for a quick poll. I'm curious, for those of you with a Medicare Part D plan, have you ever had difficult time paying for your out-of-pocket costs for prescription medications? Pick the answer that's right for you. No, never. Yes, sometimes. Yes, often. Go ahead and mark your answer, and we'll keep it open for about 30 seconds. In just a few more seconds, we'll keep it open. Okay, let's close the poll. Yeah, you know, I have to say that unfortunately, I'm not too surprised by the results. Many of you say that you've had difficulty paying for your medications, either sometimes or often. Now, we just spoke about the Part D program. Terminology can certainly be confusing in Medicare. I don't know about you, but Everything could be a lot simpler without each of the different parts of the Medicare program. So let's review these different parts briefly. Part A covers inpatient hospital stays, skilled nursing facilities, some home health visits, and hospice care. It doesn't cover visits to the doctor or your prescription drugs. People eligible for Part A are also eligible for Part B, as in boy. Part B helps pay for physician services, outpatient care, lab tests, medical equipment, preventive services, and ambulances. Part C is also known as Medicare Advantage and allows beneficiaries to enroll in a private plan as an alternative to traditional Medicare. These plans provide all Medicare-covered benefits included in Parts A and B, and may include prescription drug benefits too. Other services noted on this slide may be provided as well. And finally, we have Part D, which we've already mentioned. People in Part D plans face cost sharing for prescriptions, and amounts vary from one plan to the next. You know, every single day, more than 10,000 people become eligible for Medicare. More than half of Medicare enrollees today have incomes less than $30,000 a year. 8 out of 10 older adults live with at least one chronic condition, and 6 out of 10 live with at least 2 chronic conditions. Well, for these individuals, access to specialty medications is vitally important. But what happens when out-of-pocket costs are so high? Simply put, people are forced to make decisions about what they can afford: their prescriptions or other expenses such as rent, mortgage, utilities, or putting food on their tables. All too often, they leave the pharmacy counter without paying for their prescriptions. In fact, it's estimated that 4 out of 10 people will walk away from the pharmacy counter if faced with a copay of $125. And that's what they're doing. Every single year, between 100 and 200 million prescriptions go unfilled, costing our healthcare system billions of dollars and contributing to more than 100,000 preventable deaths every year. A poll conducted earlier this year by the Kaiser Family Foundation indicated that 1 out of 3 people have abandoned their medications. 1 out of 3. For those who do fill their prescriptions, here too unfortunate decisions may be made. Patients may decide to skip medication doses or cut pills in half to make their medications last longer. We have been talking about high out-of-pocket costs for years. More than 8 out of 10 people believe the costs for prescription medications are just unreasonable. We have all been concerned. At PAN, we strongly believe that when diagnosed with a serious illness, no one should have to worry about how to pay for their treatment. Well, fortunately, with passage of health provisions as part of the Inflation Reduction Act, there is some hope for the future. There have been many headlines in recent months about the Inflation Reduction Act, but we know that many of you may not be familiar with what's behind these headlines. So now, let's discuss these important provisions. We will review each of the provisions that you see on this timeline between 2023 and 2025 in detail. My goal through this webinar is to provide key information about these Medicare reforms. But let's get a baseline first and participate in another poll. How much do you know about the Medicare reforms passed as part of the Inflation Reduction Act? Pick the answer that's right for you. I don't know anything about them. That's why I'm here. I've heard of them, but I don't know the details. I know a lot, but I'd like to learn more. I'm an expert, could be presenting this webinar. We'll keep the poll open for about 30 seconds. And just a few more seconds. Okay, let's close the poll. Okay, well, it doesn't look like we have any experts joining us today, and I certainly don't consider myself to be an expert as well. But what it looks like, though, is that we all feel the need to learn more. So let's get started. In 2023, 2 provisions will be implemented in just a matter of months on January 1st, 2023. They are no copays for vaccines and a monthly cap of $35 for insulin. Let's look more closely at the vaccine provision. This slide illustrates that today, certain vaccines are covered under the Medicare Part B, as in boy program, while others are covered under Medicare Part D, as in David. Vaccines in Part B do not come with cost sharing. However, many of you may have experienced copays for vaccines in the Part D program or in Medicare Advantage plans, such as for the shingles vaccine. Depending on one's plan, costs for the 2 doses that are needed for the shingles vaccine, for example, can cost several hundreds of dollars. But the good news is that starting in January 2023, Part D plans will not require a deductible, coinsurance, or other cost-sharing requirements for adult vaccines that are recommended by CDC's Advisory Committee on Immunization Practices, and this will include shingles. It's estimated that this provision will help more than 4 million people on Medicare. The second provision taking place in 2023 is the establishment of monthly caps for insulin. Sadly, today, about 1 in 4 individuals 65 years of age and older lives with diabetes. More than 3 million Medicare Part D enrollees use insulin, and each year more than $1 billion is spent on out-of-pocket costs for insulin, with the average cost for each prescription being around $54. Well, the Inflation Reduction Act limits monthly cost sharing for insulin products to no more than $35 for Medicare beneficiaries per month, including insulin covered under both Part D, as in David, and Part B, as in boy. No deductibles will apply. All Medicare Part D plans, both standalone plans and Medicare Advantage drug plans, cannot charge more than $35 per month for whichever insulin products they cover. But it's important to note that plans will not be required to cover all insulin products. So if you receive, for example, a 60-day supply for a Part D covered insulin, you won't pay more than $70. That's $35 for each month times 2 months. Beginning in July 2023 is when similar caps on costs will apply for insulin used in traditional insulin pumps covered by the Part B, as in boy program. And finally, this insulin provision applies to people enrolled in the Extra Help program as well, which we're about to talk about. So let's turn to 2024. Similar to 2023, 2 health provisions will go into effect in 2024. The first is the expansion of the federal low-income subsidy program. This program is commonly referred to as Extra Help. The second provision is a Medicare reform that will start lowering out-of-pocket costs. Let's review the extra help provision. Today, nearly 13 million people benefit from the federal low-income subsidy program. 400,000 more individuals can benefit when this provision goes into effect in 2024. The low-income subsidy, or extra help program, helps beneficiaries with their Part D premiums, deductibles, and cost sharing for prescription medications. Remember I mentioned earlier how complicated Medicare is? Well, this is a great example. The extra help program can be very difficult to understand. It's also difficult to apply for. Today, people on Medicare can qualify for either full or partial benefits in this program. And as you can see here on the slide, your eligibility will depend on your income and other resources, such as your assets. Your income is evaluated against federal poverty level guidelines. So what's the bottom line? The Inflation Reduction Act eliminates the partial program. Full benefits will be offered to people with incomes up to 150% of the federal poverty level. Today, based on current federal poverty level guidelines, that's about $27,465 for a family of two. That's good news. Hundreds of thousands more people will be able to have the majority, if not all, of their out-of-pocket costs for prescription medications covered. I'm really excited about this next provision that I think few people have heard about, and that is the elimination of the 5% coinsurance for Part D catastrophic coverage. As an aside, don't you think when the Medicare benefit was being designed, they could have come up with a better word than catastrophic? Well, what happens in 2024 is that, in essence, there will be sort of a Part D cap or limit on what you pay for medications. To understand what all of this means, and it can be complicated, let's talk about how the benefit currently works and how it will work in 2023. I know the print on this slide and the next couple of slides are small, but don't worry. When we send the slides to you following the webinar, you should be able to read it much better. Well, this coming January 2023, when benefits reset, people on Medicare will pay $505 for their deductible. Just as a comparison, it was $480 this year. On this slide, I want to call your attention to the dark blue color for enrollees. That's the first circle on the left at the bottom. After the deductible is paid, someone on Medicare will pay 25% of drug costs. At the point when they have spent around $3,100, they'll enter what's called the catastrophic phase of their benefit. In this phase, they will have to spend 5% of drug costs without any limit. Now, while 5% may sound like a low number, 5% of an expensive medication can be a very big number. But all this changes in 2024. In 2024, the 5% cost sharing obligation is removed. According to the Kaiser Family Foundation, this will be like having a cap of around $3,250 for the calendar year. Conservatively, we estimate this benefit will help more than 1.3 million people. But the big change comes in 2025, when there will be a hard cap or limit of $2,000 for prescription medications. No one will spend more than $2,000 a year for their prescription medications, and this benefit will help an additional 1.4 million people at least. Well, for those on expensive medications, having a cap on what they spend out of pocket is for sure good news. but we know that for many, $2,000 is still a lot of money. So just a quick recap. Unfortunately, in 2023, many of you needing expensive medications will still experience high out-of-pocket costs. In 2024, your costs may come down when the 5% cost sharing in the catastrophic phase goes away. In 2025, no one on Medicare will pay more than $2,000 in out-of-pocket costs for their prescription medications. There is further good news in 2025. In addition to the $2,000 cap, there is an opportunity to more evenly distribute these costs throughout the year. People will need to opt in for this program. Well, we all know that January can be a difficult month in terms of paying deductibles and out-of-pocket costs for medications. It truly feels unfair that such high out-of-pocket costs need to be paid at the beginning of each year. But in 2025, each prescription drug plan, including Medicare Advantage plans, must give each enrollee the option to pay for their out-of-pocket prescription costs in monthly installments with a monthly limit on spending. At PAN, we call this provision smoothing, as it more evenly distributes costs throughout the year. Smoothing will not be automatic. You will need to opt in for this program. When combined with the Part D cap and smoothing can go a long way to making out-of-pocket costs a whole lot more affordable. Let me give an example of what this looks like. Let's say the medication you need costs $12,000 out of pocket per year. In 2023, you may very well hit that catastrophic threshold of $3,100 in January. Your monthly cost the remainder of the year can be quite high, maybe around $800 per month. But let's look at what happens in 2025. As we've discussed, in 2025, you will not pay more than $2,000. Prior to 2025, your Part D plan informs you that you can opt in to more evenly distribute your costs, and you elect to do this. In this scenario, you will have a monthly cap of $166 per month. That's $2,000 divided by 12 months. Well, that certainly makes medication costs a whole lot more affordable and predictable. There's one more thing I'd like to note. Right now, the provision states that if someone fails to make even one monthly payment, they can be terminated from the smoothing program. We think that's unacceptable, and why PAN, working side by side with many other patient groups, will do all we can to make sure that the right patient protections are in place when implemented by CMS, which is the Center for Medicare and Medicaid Services. One final item I'd like to mention relates to the Medicare Part D program premiums. For the period of 2024 to 2030, increases in Medicare Part D premiums cannot exceed 6% each year. Well, I know that was a lot of information to take in. I'd love to see if, based on the information I've provided, you have a better understanding of the Medicare reforms. So this is our final poll for today. How well do you understand the new Medicare reforms? Click on the answer that's right for you. I still don't understand them all. I understand some of them, but not all of them. I understand all of them, but still have some questions. I understand all of them and feel comfortable sharing this information with others. And we'll pause for 30 seconds. In just a few more seconds. Okay, we'll close this poll. Thank you for completing this final poll. Again, I'm not surprised by the results. You know, Medicare is complicated and all of this can be really hard to understand. But don't worry, this is just the beginning. We plan to provide more information as we get closer to when these reforms will be implemented. So let's now review some key takeaways and a few important things for us all to remember. In just a few months, in January 2023, two important reforms will take place. No copays for vaccines and that monthly $35 cap on insulin. Relief in total out-of-pocket spending is in sight. Relief may start in 2024 with the elimination of the 5% cost sharing in the catastrophic phase. The $2,000 annual cap takes place in 2025, and the ability to opt in for smoothing and a monthly cap also takes place in 2025. As mentioned earlier, $2,000 in out-of-pocket costs is still a lot of money for many. Please know that the PAN Foundation will continue to be here to help with your out-of-pocket prescription costs. As provisions are implemented, your Part D plan should provide updates to you. But the PAN Foundation will also be here to support and educate you along the way. All of you will receive a recording of this webinar, the slides, a printable graphic that summarizes the timeline of the health provisions we've talked about today. And based on all the questions we've received, we will be putting together a frequently asked questions document that we'll make available to all of you. Our website, panfoundation.org, will be your source of information about Medicare reforms. Of course, if you need financial assistance for your prescription medications, panfoundation.org is a good place to start. Our website also includes an important education hub about the low-income subsidy or extra help program, and I encourage you to visit to see if you're eligible. Finally, a reminder that open enrollment is right around the corner. It starts October 15th and ends on December 7th. This is the time when you can enroll in a Medicare plan or make changes to your existing plan. These future Medicare reforms that we've discussed today will not affect open enrollment. Well, it is now my distinct pleasure to introduce to you George Valentine and Joan Powell. George and Joan both know firsthand the impact of high out-of-pocket costs for medications. They have joined today to ask me questions that many of you have submitted through the registration process. Before we begin, a reminder that all of you can continue to send questions our way through the chat function. If we don't get to them today, please be assured that they will be received, they will be reviewed, and we'll address them in our frequently asked questions document we're putting together. So George and Joan, welcome. I hope this webinar was helpful to both of you, and I'm wondering what each of you think of these Medicare reforms. Maybe Joan, we'll start with you. I think we're having a problem hearing Joan.
Okay, can you hear me now?
Yep.
Okay, sorry.
Thank you, Joan.
Sorry about that. Okay. As I said before, greetings from Southern California. Briefly, I was just diagnosed in 2014 with a rare blood disease. It's called myelodysplastic syndrome. So my main concern with this seminar was, as a cancer patient, the excessive cost of my prescriptions. I tell people I not only are worried about my disease, but I worry about the fact that I have a hard time at times finding my copay payments. So that's why this seminar has been very, very important. The presentation today gave me an added resource. I say it's a maze of healthcare and stress-filled financially, but now I seem like I have more of a compass for my future and for my survival. I just want to say that I'm overjoyed that in August of 2022, that the Inflation Reduction Act was passed by Congress. It assists us, especially those on Medicare. And as I said, as an advocate, being a voice for the voiceless, it allows me to spread, as she said, the good news for a better quality of life for the patients. Thank you.
Thanks so much, Joan. George?
Yes, Amy, I found the information you provided to be insightful and has definitely increased my initial understanding of the Inflation Reduction Act. I was diagnosed with a chronic form of leukemia in 2002, and over the last 20 years, I've experienced firsthand some of the financial challenges associated with high out-of-pocket costs. I feel this law will help me and numerous other patients achieve better treatment outcomes.
Thank you. Thank you so much again for joining and for sharing your perspectives. Let's turn to the questions that so many of you have sent our way through the registration process. Joan, would you like to go first?
Sure. One important question is, why are these changes taking so long to take effect?
Joan, that's a great question. And from my perspective, I truly wish that in particular, the cap and smoothing Medicare reforms could take effect in January of 2023. But remember, it's taken many, many, many years to convince Congress that changes to the Medicare program were needed. So while 2024 and 2025 truly feel like so far away, we're grateful that these Medicare health provisions are finally enacted. And we know that CMS likely needs some time to figure out how implementation will work behind the scenes.
Amy, understanding that this thing will take place over several years, will we be alerted before changes take effect?
Yes, you should absolutely receive information from Medicare and your Part D plans about these provisions before they go into effect. As a matter of fact, I've recently seen information already about the vaccine provision that's going into effect in January. But remember, PAN will also be here to continue to educate patients and providers about important timelines, including next steps.
My question is this: how will these changes affect my insurance?
These changes won't affect your current Medicare enrollment and should not impact your decisions around open enrollment, which is coming up in just a matter of days. As always, we encourage all of you joining us today to make sure you select plans that best match your prescription needs and your medical needs.
Will this affect Medicare Part C drug costs?
Yes, and remember, Medicare Part C relates to the Medicare Advantage plans. The provisions we spoke today apply to Medicare Advantage plans that have prescription drug programs.
Another question I have: will these changes apply to all specific tiers and medications? And also, are there any drugs excluded from the Part D cap? I'm concerned about that.
Yeah, so these changes apply to all Part D plans and medications covered by the Medicare program, and it has nothing to do with where the drugs are placed, such as on the specialty tiers. The cap relates to one's out-of-pocket costs. No drugs are excluded. No drugs are excluded. The reform really is completely agnostic to what drugs you may be taking.
Will me and other patients be faced with taking different medications to get reap the benefits of the savings?
Yeah, no, you will not. You will not have to change medications in order to benefit, for example, from the Part D cap and smoothing provisions. Ultimately, what medication is best for you really is a decision between you and your healthcare provider.
I have a concern. Now, since I'm a grant recipient over the years, how will these changes affect a patient's grant that they have with PAN?
That's a very important question, and I can imagine many of those joining today have the same question that you have, Joan. These changes will not affect grants for those currently receiving financial assistance from the PAN Foundation. And if you're a provider who's joining us today, the process for enrolling patients in grants is also not changing. Remember, in 2023, especially for people living with serious illnesses and needing these specialty medications, patients may still face very high out-of-pocket costs, and the PAN Foundation will be here to help. It's not until 2024 when out-of-pocket costs may come down. Like we do every year at PAN, we will continue to evaluate our programs, our assistance amounts, and any future changes we make will be included on our website.
Did the Inflation Reduction Act include expansion of dental, vision, and hearing benefits for people on Medicare?
Another great question, George. I wish it did, sincerely. You know, at PAN, we have long advocated for expansion of these benefits in the Medicare program. Honestly, to me, it simply does not make sense that these services that are needed by millions of people are not covered. But there is some good news relating to hearing, pertaining to hearing aids. More affordable hearing aid options are really about to become a reality thanks to a new category of over-the-counter hearing aids established by the Food and Drug Administration, the FDA, just in August. The average price of over-the-counter hearing aids could be literally several $1,000s lower than that of prescription hearing aids. That's a big difference. Over-the-counter hearing aids should be available in stores and online literally any day now. And you won't need a hearing exam or a prescription or even a fitting appointment to take advantage of this benefit.
I have a concern, I guess. Well, for some people that I am at the Medicare age, but I know I have patients that I know they're not quite sure of the Medicare age and still on the exchanges. Is there any reduction in the Inflation Reduction Act relating to the ACA?
Yes, well, I mean, while we talked a lot today about Medicare reforms, there is one reform that was included in the Inflation Reduction Act that does pertain to people who are not yet eligible for Medicare. In 2021, the American Rescue Plan Act temporarily lowered healthcare costs for many marketplace consumers by increasing financial assistance based on their income level. These short-term subsidies were set to expire at the end of this year, 2022. But with the Inflation Reduction Act, these enhanced premium subsidies have been extended through the end of 2025. And that's really a good thing, because without that extension, many people might have seen a significant increase in their monthly premiums.
You know, getting prior authorization is such a problem, and it can have a negative impact on patient care. Is there anything being done about this?
Yeah, George, we hear so much about this problem, how prior authorization prevents or slows down access to treatment for many. It's a problem for patients, it's a problem for healthcare providers. What we know is that in the House of Representatives, They actually passed a bill called HR 3173. It's called the Improving Seniors Timely Access to Care Act. And it establishes requirements and standards relating to prior auth for Medicare Advantage plans. Now, it hasn't been considered yet in the Senate. We know it has a lot of support in the Senate, but it's possible that something might happen by the end of this year. I think we just have to wait and see.
Getting prior authorization is such a problem at times. I could tell you many nightmares that I've had in the last years, and it can have such a negative impact on patient care. Is there anything being done about this?
Yeah, that was the question we just answered. And, prior authorization, it truly is something that can impact many. We don't like hearing when so many patients need to get prior authorization, need to be put through what's called step therapy, because in our opinion, it really slows down the access to needed medications and needed treatment. So at PAN, working with other organizations, we're going to do all we can to make sure that prior authorization and in general what's called utilization management rules or guidelines are not too restrictive.
I've heard a lot about changes in drug pricing as a result of this legislation. Is there anything you could share related to that?
Yeah, and I think I'm not seeing the slide advance, but let me address the drug pricing legislation. In addition to the Medicare reforms, the Inflation Reduction Act also addresses drug prices, and this is very complicated as well. For the first time, the federal government will negotiate prices for some top-selling drugs covered under Medicare Part D beginning in 2026 and Medicare Part B beginning in 2028. The number of drugs that are going to be subject to drug price negotiation will vary. So for example, in 2026, there'll be 10 Part D drugs, another 15 Part D drugs in 27, another 15 Part D and B drugs in 2028, and so forth. The number of Medicare beneficiaries who will see lower out-of-pocket costs in any of these years and the magnitude of those savings will really depend on a few things. One is how many and which drugs are subject to the negotiation process and how much price reductions are achieved. So a lot of details yet to be figured out. We have not seen, for example, that list of the initial 10 drugs for whom their prices will be negotiated. One more thing, additionally, beginning in 2023, the drug manufacturers will be required to pay what's called rebates back to the federal government if drug prices for their Part B or D drugs increase faster than the rate of inflation.
Are there any disadvantages to these Medicare reforms? I haven't seen any, but you're always cautious.
Yeah, and it's right to be cautious because with any legislation, there could be unintended consequences. So, for example, some speculate that as a result of these reforms, some plans could use greater utilization management practices that we just spoke about that may prevent access to certain medications. But it's really too early to tell. We have to wait for implementation of these Medicare reforms to truly see what the potential impacts could be.
Well, Amy, you certainly answered a lot of questions, and I'm sure there's a lot more. How can I get more information about these reforms if I still have additional questions?
Thanks for asking that, and many of the people who registered for the webinar asked a very similar question. So our website, which is panfoundation.org, can be a key source of information for all of you. If we can advance to the next slide. You can also email us here at PAN at education@panfoundation.org. So following this webinar, if you have any additional questions about the Medicare reforms, don't hesitate to email us at education@panfoundation.org. But there are 3 more resources that I want to make sure you all have today. And the first is simply Medicare. You can either go to medicare.gov to learn more, or you can call them at 1-800-MEDICARE. The second resource is the National Council on Aging. This is truly a great organization that offers terrific resources for Medicare beneficiaries. And their website is www.ncoa.org. And then finally, the third resource I want to share with you today is a resource called the State Health Insurance Assistance Program. They offer free personalized health insurance counseling. It's truly a great resource, and you can find out where to go by visiting their website, which is www.shiphelp.org. Well, George and Joan, thank you so much again for these questions. And unfortunately, we're running short on time. I want to thank all of you for joining our webinar today to learn about these historic Medicare reforms that were passed as part of the Inflation Reduction Act and will have the potential to lower out-of-pocket costs for prescription medications. Again, if you have any questions that you are thinking about following the webinar or in weeks to come, email us at education@panfoundation.org. As mentioned earlier, we will be following up with a recording of the webinar, the slides, a printable graphic of the Medicare reforms, and a frequently asked questions document. Also, expect to see reminders from PAN in advance of the health provisions taking effect. We hope this webinar was helpful, and we truly look forward to leading additional webinars on topics that are important to all of you. So thank you again, and have a wonderful rest of your day. Take care.